Hello everyone, my name is Navid Pasha Khadri Sayyed, and today I will be presenting on the role of nurses in improving healthcare access and quality in United States. Whereas coming to the introduction, the article I selected that examines how nurses enhance healthcare by improving navigation, communication and cultural respect within care setting. Here I summarize the key ideas from article that connects them to our course textbooks, Delivering Healthcare in America by Shai and Singh. The topic is especially important because nurses make up the largest segment of healthcare workforce and have a direct impact on patient quality and equality. The selected articles evaluate the role of nurses in enhancing the quality of healthcare following the principle of better navigations, communication and respect of the other cultures in the care settings. The given presentation outline the key ideas in the articles and connect them to the text of Delivering Healthcare in America. Whereas coming to the article in summary, the article explains that nurses play a central role in improving the quality of healthcare through several major strategies. Nurses improve the quality of care by advising patients in a complex healthcare system and reducing fragmentation. Three central strategies. Initially, the first one is care management, which improves, coordinates, eliminates duplication and engage more person-central care, which is the second one, which mainly focus on autonomy preferences, health literacy and individualized care. And the last and the not least but which is cultural humility, tackle structure inequities and implicit bias in the delivery of equitable care that is respectful. COVID-19 also disproved the role of nursing in the field of telehealth, broadened the scope of practice and community-based interventions, science, engineering and medicines and community. Committee on the Future of Nursing 2020, 2020-30 and 2020-21. Relation to course textbooks. According to Shai and Singh's 2026, the fundamental issues of the healthcare US systems are care, coordination, access, and health disparities. This article aligns closely with themes in Shai and Singh's in 2026. The textbook emphasizes system fragmentations. The article also supports the textbook's focus on workforce transformations. Social determinants of health both emphasize the importance of focusing on social, cultural, and economic determination of care delivery. The growth of telehealth in times of COVID is indicative of textbook's discussion on new innovations in delivery. Whereas coming to the analysis, the article is more practice-based and real world as compared to the textbooks which focus in a much more structural and policy-based manner. Both concur on the fact that the complete scope of practice of nurses is crucial. Through the article provide better evidence of less readmissions due to the presence of transition care models, better patient outcomes obtained with the help of person-centered and culturally competent care. The article takes a more assertive position on structural racism and implicit bias spheres that are mentioned in the textbooks only in passing. On the whole, the articles makes a more urgent call to have nurses empowered to improve the quality of care nationwide. Implications are such as the implications of this article are significant for multiple levels of the healthcare system from a policy perspective. Organization should in care coordination, transitional care programs, and interprofessional communication. Training of the workforce. Cultural humility and bias management should become a part of nursing education as well as long life learning, whereas technology, remote care, and telehealth capabilities can improve the access and continuity of older adult children and patients with complex care. Public health nurses are critical in bridging the gap between clinical care and community support and solving SDOH. Whereas coming to the end conclusion, in conclusion, the article emphasized three major contributions. The first one is nurses make to improving healthcare quality, and the second one is care management, and the third one is person-centered practice and cultural humility. Care management, person-centered practice, and cultural humility are the keys of the nursing that can enhance the quality of healthcare in the United States, improve patient outcomes, and efficiency of the system can be achieved through better nurse leadership, telehealth expansion, and structural inequities. Last but not least, there are certain references for this topic, which are National Academy of Science, Engineering and Medicines and Committee on the Future of Nursing 2020 to 2030. The role of nursing in improving healthcare access and quality in the future of nursing 2020-2030, charting a path to achieve a health equity. National Academic Press, Shai L. and Singh D.A. 2026, Delivering Healthcare in America, a System Approach, 9th edition, Jones and Bartlett Learning. Thank you very much for your time and patience.